Welcome back to the Hematology, Oncology, and Immunological System and Disorders. We are still talking about anemia, and we're going to be going to the megaloblastic or macrocytic anemia. Macrocytic anemia, also known as megaloblastic anemia, is an anemia that you'll see in patients with either folic acid or B12 deficiencies. When it comes to B12, it could be either through dietary or through the lack of intrinsic factor that is causing malabsorption of the B12. So, but when it comes to folic acid, it might just be definitely through deficiency. What kind of patients are you going to see with this? You might see patients with alcohol use disorder. There might be hypothyroidism or reticulocytosis. How would you see this disorder in the lab? You'll see it, as the name implies, you'll see IMCV, MCV greater than 100, and then you definitely see low red blood cells and low hemoglobin and hematocrit because it is an anemia. But you cannot differentiate unless you check the levels in terms of whether it's a folic acid deficiency or a B12 deficiency. Prior to checking the levels of the folate or the B12, the other thing you can do is through assessing the patient history and discussing the signs and symptoms. If your patient tells you that they have any kind of neuropathy or parathesia or any kind of neurological symptoms, then that's what differentiates the folic acid from B12. So any kind of neurological symptoms will be a B12 deficiency. Also, if you it does not mean that your patient cannot have a concurrent folic acid deficiency and B12. But if they have both, you want to treat your B12 first because you want to prevent neurological complications. Then, when you, like we said, you look at these patients that comes in with the patient that has alcohol use disorder, or even pregnant patients, you'll see folic deficiency in those kind of patients. In pregnancy, it's just because of high demand, so that's why we always substitute give them folic acid supplements. But in alcoholics, is dietary. It could be is dietary, and just other things that is causing the folic acid deficiency, which I don't really want to go into in this video. Another thing I want you to be aware of, in patients that are on metformin, you want to monitor their B12 because it kind of depletes it. So how do we treat it? For folic acid, you're going to give them folic acid supplements and encourage them to eat food that is rich in folic acid. For B12, we're going to give them the B12 supplement, which is called cyanocobalamin. Cyanocobalamin, if it's dietary, they can take it orally, but definitely if it's pernicious anemia, you want to bypass the oral route. You want to give it to them through the IM, and they will take this like one daily for a week, then you start monthly. You want to let them know that this is going to be a lifetime administration. So next we're going to talk briefly about hemolytic anemia. Thank you.